Do you ever wonder why your lower back pain persists despite the exercises, back stretches, rest, medication, or even surgery you've tried? The answer might be hiding deep within your core, and I'm not talking about your abs. You can do all the work you like on your back, but if you don't address this problem with your hip flexors, your back pain will keep recurring. When the hip flexors become tight or weak, it creates a cascade of problems throughout the body. You see, so many people with back pain don't recognise that the pain is not originating purely from the back, and here's why the hip flexors matter. In a nutshell, it's because they're primary muscles that lift the leg forward in any movement. That means they're the major muscles that work hard when you walk, run, climb, jump, and even cycle. And when these muscles are tight, they pull the spine forward, creating compression and that curve in the lower back. It's also one of the reasons we find people stoop as they age, because these muscles are so tight they don't allow you to stand up tall. The main thing that causes these muscles to shorten and tighten is sitting. In our modern world, we all sit too much, at work, behind the wheel, commuting, and at home. Some people spend most of the day sitting. And as we get older, or if we're dealing with aches and pains, we often spend even more time sitting. Our bodies are not designed for this, and it causes knock-on problems. Because of all this sitting, the hip flexors get used to being contracted and in a shortened state, and it becomes harder and harder for them to stretch and lengthen. And these muscles are tight, they can even rotate the pelvis in a forward position. This can lead to uneven stress on your knees and fundamentally affect your movement patterns, because it stops you from moving your leg forward in a natural way. It leads to problems with pushing off from your feet, which can result in a shuffling movement. And this hip flexor pain contributes to pain in other parts of the body too, starting with the neck, shoulders, and even down to the ankle, all simply from not being able to stand up tall. So a perfect storm is created for pain and dysfunction that just keeps worsening with age. So here are 3 simple, accessible exercises to help you get rid of the lower back pain, simply by lengthening these crucial muscles deep within the hips. So for this first exercise, you're going to need a ball. I've got a lacrosse ball here, you can use a tennis ball. And what we're looking to do with this ball is to find the hip bone, and we're going to work in about 2 inches, about 5 or 6 centimeters towards the midline. So with the ball in place right on the hip flexors, laid on our stomachs, we're just going to do 5 nice big relaxing breaths, just relaxing into that ball and feeling that tension disappear. So using something like a towel to rest the knee on. From there, we're just going to bring the other leg forward, and this is the side that we're going to be stretching. So from here, we're just going to be driving that hip forward, opening the hip flexors, and you should really feel a nice deep stretch. And the third exercise we're going to be doing is one called 90-90. And what we're looking to achieve is a 90-degree angle at the front knee, a 90-degree angle at the pelvis, and a 90-degree angle on the back leg as well. And then from there, like we've done previously, we're just driving this hip forward, and you'll again feel a nice big deep stretch through these hip flexors and really drive that hip forward. And we're aiming to hold this for between 30 and 45 seconds on each side, switching sides to make sure that we capture both hip flexors. Give these exercises a try, and please save and share with anyone you know is struggling with any lower back pain and who wants to stay active and pain-free.